Welcome back to Senior Healthty Care, where you will discover several recommendations for seniors. Today, we offer crucial recommendations that seniors should not overlook, prevent stroke after 50. 5 proven exercises you can start today. For senior wellness. A stroke occurs in the United States about every 40 seconds, and the Centers for Disease Control and Prevention (CDC) reports that more than 80% of these cerebrovascular events are preventable. This severe epidemiological reality underscores the critical need for population-level preventive strategies and individual behavioral choices that reduce risk. Pharmacological treatments for hypertension, dyslipidemia, and atrial fibrillation are essential elements of stroke prevention. An expanding and more rigorous body of scientific research underscores the substantial, sometimes neglected effect that certain exercise patterns have on the physiological systems affecting cerebrovascular health. The effects are particularly evident in individuals over 50, as the prevalence of major stroke risk factors, hypertension, insulin resistance, type 2, diabetes, atrial fibrillation, and atherosclerotic disease, significantly escalates with age, exacerbating age-related declines in muscle mass balance and resilience. Many very advantageous workouts for reducing stroke risk may not need specialized equipment, costly gym memberships, or strenuous physical exertion. They concentrate on advancing a set of interrelated physiological goals that are mechanistically linked to cerebrovascular disease regulation of blood pressure and autonomic tone, preservation and restoration of endothelial and vascular function, enhancement of metabolic health and insulin sensitivity, maintenance of musculoskeletal integrity and functional mobility, and stimulation of adaptive brain mechanisms encompassing neuroplasticity and cognitive reserve. This comprehensive analysis assesses 5 evidence-based modalities: Tai Chi, brisk walking, swimming, including aquatic exercise, resistance training, and dancing, each supported by clinical studies and observational cohorts, demonstrating stroke and cardiovascular protective effects through unique yet interconnected mechanisms. For each modality, I outline the physiological rationale, emphasize key study findings, and provide practical recommendations for safe and effective incorporation into daily living. The last section addresses the increasing knowledge on exercise timing and circadian biology, suggesting that the time of physical activity may affect cardiovascular and metabolic benefits. Tai Chi. An ancient Chinese movement practice, sometimes referred to as meditation in motion, has garnered contemporary recognition as a therapeutic exercise for seniors. It comprises intentional, slow, and fluid movements, coordinated with purposeful breathing and concentrated concentration on posture, weight distribution, and movement sequence. Although exercise seems low impact, Tai Chi engages complex sensorimotor pathways, autonomic regulatory systems, and cognitive networks that are crucial for stroke prevention. The mechanisms through which consistent Tai Chi practice reduces cerebrovascular risk concentrate on 3 key domains: regulation of blood pressure and stress enhancement, of neuroplasticity and cognitive reserve, and augmentation of proprioceptive function, resulting in a lowered risk of falls. Regulation of blood pressure and stress. Hypertension is the primary modifiable risk factor for stroke. Tai Chi favorably affects blood pressure via immediate autonomic alterations and sustained neuroendocrine modifications. Focusing on diaphragmatic breathing, slow-paced activities, and focused attention techniques often diminishes sympathetic outflow, the fight-or-flight response, and increases parasympathetic vagal tone. Practitioners often demonstrate increased heart rate variability, a marker of autonomic flexibility, and reductions in resting systolic and diastolic blood pressures after regular practice. Regular activation of relaxation responses diminishes circulating stress hormones such as cortisol and catecholamines. Persistently elevated cortisol and sympathetic activity correlate with prolonged vasoconstriction, endothelial dysfunction, heightened resting heart rate, and a pro-inflammatory milieu. Tai Chi cultivates a physiological environment that improves vasodilation and supports autonomic balance, thus establishing a vascular condition less conducive to plaque buildup and thrombotic events. Neuroplasticity and cognitive resilience. Neuroplasticity denotes the brain's capacity to reorganize neural networks in reaction to practice learning and novel challenges. The sequential movements of Tai Chi require balance control, sensory motor integration, working memory for memorizing movement patterns, and sustained attentional shifting. Cognitive demands augment functional connectivity across brain regions, including the cerebellum refining motor coordination, hippocampus enhancing memory, basal ganglia habit formation, and motor sequencing, and prefrontal cortex executive function. Consistent stimulation and improvement of these circuits may create a cognitive and motor reserve that allows the brain to better withstand or recover from vascular damage. Acquiring new motor sequences and refining complex coordination mechanistically promotes synaptogenesis and stimulates the synthesis of neurotrophic factors such as brain-derived neurotrophic factor BDNF and insulin-like growth factor 1, IGF-1, which are linked to synaptic plasticity and neuronal viability. Proprioception and fall prevention. Proprioception. The inherent sense of limb and body orientation in space declines with age, resulting in balance impairments and heightened fall risk. Falls in the elderly constitute a considerable public health concern as they may result in traumatic brain injury, cerebral hemorrhage, and subsequent functional decline, hence heightening vulnerability to vascular complications. The intentional weight shifts one-sided postures and continuous focus on center of mass alignment in Tai Chi provide targeted training for the proprioceptive and vestibular systems. This retraining enhances neuromuscular coordination, postural reflexes, and gait stability, reducing the likelihood and severity of falls, thereby addressing a sometimes overlooked but clinically important facet of stroke prevention. Empirical evidence from clinical trials. A plethora of randomized controlled trials and systematic reviews validate the physiological and functional benefits of Tai Chi for the elderly. Studies indicate mild but clinically significant reductions in blood pressure improvements in balance assessment scores, e.g., timed up-and-go single-leg stance, and decreases in inflammatory biomarkers such as C-reactive protein in practitioner groups compared to control treatments. A 2017 study showed improvements in vascular elasticity and cognitive evaluations in those over 60 who participated in sessions thrice weekly, while other meta-analyses showed reduced fall rates among community-dwelling older adults practicing Tai Chi. Tai Chi, often performed in communal settings, promotes social interaction that independently improves cardiovascular and mental well-being. Social isolation is an acknowledged risk factor for adverse cardiovascular events, including stroke. Pragmatic guidance. A typical Tai Chi session for seniors lasts 20-40 minutes, including a brief warm-up, 15 to 25 minutes of form practice, focusing on modest weight transfers and mindful respiration, and concluding with a short cool-down with breathing exercises and gentle joint movements. Instructors emphasize posture indicators, bent knees, aligned spine, and relaxed shoulders, coupled with a progressive pedagogical method that gradually presents new sequences. No particular equipment is necessary, save for comfortable footwear and loose-fitting clothing. For those with balance impairments, practicing seated Tai Chi or using a chair for restricted weight-bearing may provide several benefits while decreasing the risk of falls. Beginners may start with 2 to 3 sessions per week and gradually increase the frequency to almost daily as their confidence and skills improve. Expeditious ambulation. Brisk walking is one of the most accessible, scalable, and cost-free strategies to reduce stroke risk. When performed at the recommended intensity and frequency, it offers significant benefits by improving cerebral perfusion, regulating metabolic functions, conditioning cardiovascular responses, and fostering vascular resilience. Brisk walking is often characterized by a pace of around 3 miles per hour, or roughly 100 steps per minute, an intensity that permits conversation but complicates singing the talk test. This moderate-intensity aerobic exercise enhances cardiac output, thus augmenting the delivery of oxygen and nutrients to the brain while maintaining cerebrovascular reserve. Mechanisms: cerebral perfusion and angiogenesis. Regular aerobic exercise improves the brain areas most susceptible to vascular damage, the hippocampus and frontal lobes, by maintaining microvascular supply and facilitating angiogenesis, the formation of new capillaries and small collateral networks. Angiogenesis and increased microvascular density may provide alternative routes for blood circulation in instances of localized arterial restriction, therefore reducing the risk of ischemic injury. Aerobic exercise improves endothelial function by augmenting nitric oxide bioavailability and vasodilatory responsiveness, hence decreasing arterial stiffness and lowering systolic blood pressure. Regulation of metabolic processes and control of postprandial glucose concentrations. A clinically important benefit of walking is its effect on glucose metabolism. A recent study published in the journal Stroke revealed that those over 50 who participated in 150 minutes of brisk walking weekly saw a 27% reduction in stroke risk, supporting public health guidelines that encourage 150 minutes of moderate intensity exercise per week. Walking soon after meals greatly improves metabolic results. Brief, 10-15-minute walks postprandially effectively diminish postprandial hyperglycemia, the transient, sometimes considerable rise in blood glucose after the intake of carbohydrate-dense meals. Postprandial glucose variations are particularly harmful to the endothelium. Recurrent spikes provoke oxidative stress inflammation and glycation of vascular proteins, all of which facilitate atherosclerosis. Brief episodes of muscular activity after meals improve glucose uptake in skeletal muscle via insulin-independent mechanisms, activation of AMPK, and translocation of GLUT4, hence enhancing glycemic control and insulin sensitivity. Psychological and environmental factors. Green exercise. The context in which walking occurs affects its benefits. Studies indicate that walking in natural green settings such as parks, tree-lined streets, and waterfronts results in greater reductions in cortisol and systemic inflammation, along with improved heart rate variability, compared to walking in highly urbanized surroundings. The phrase green exercise denotes the combined effects of participating in physical activity in natural environments. Interaction with nature provides sensory experiences that calm the autonomic nervous system, reduce rumination, and enhance mood, hence amplifying the cardiovascular advantages of walking. For many individuals, combining brisk walking with accessible green spaces is an excellent strategy to enhance both psychological resilience and physical health. Pragmatic prescription and progression. A weekly prescription aligned with standards is 150 minutes of brisk walking, which may be divided into 30-minute periods on most days or several shorter intervals. Individuals with limited baseline mobility or inadequate fitness should start with workouts lasting 10-15 minutes, progressively increasing by 5-minute intervals each week. Incorporating 10-15-minute postprandial walks after the main meals, e.g., lunch and dinner, improves glucose control without requiring much additional time. Monitoring devices such as pedometers, step counters, or smartphone applications improve adherence and provide objective feedback. A commonly suggested objective is 7,500, 10,000 steps per day for older adults aiming to reduce cardiometabolic risk, although personalized targets should take into account baseline activity and functional capacity. Safety precautions include wearing supportive footwear, ensuring hydration, choosing well-lit and known routes, using walking sticks when balance is compromised, and being alert to vehicle and environmental hazards. Urban pedestrians may have enhanced autonomic and anti-inflammatory advantages by intentionally selecting routes that include parks or green corridors. Aquatic exercise and swimming. Swimming and water exercise provide a third evidence-based option, offering a low-impact holistic approach to cardiovascular and respiratory fitness, particularly advantageous for those with musculoskeletal limitations. The buoyancy of water markedly alleviates joint tension, facilitating an expanded range of motion, and making swimming suitable for elderly individuals with osteoarthritis, joint pain, or other ailments that limit land-based exercise. Aquatic exercise provides cardiovascular stimulation, muscle enhancement via fluid resistance, and neuromuscular coordination training, all of which promote brain and vascular health. Physiology of the cardiovascular and respiratory systems. Regular swimming promotes beneficial cardiac adaptations, including improved left ventricular filling and stroke volume, the amount of blood ejected with each heartbeat, resulting in a lower resting heart rate and increased cardiac efficiency. Enhanced stroke volume and cardiorespiratory fitness promote stable brain perfusion and reduce hemodynamic strain on the vascular endothelium. Submersion in water produces hydrostatic pressure that increases venous return to the heart, so enhancing circulation and reducing peripheral edema. This effect may encourage beneficial endothelial shear stress patterns that stimulate nitric oxide synthesis and support vascular health. Regulation of breathing and brain perfusion. The rhythmic breathing strategies used in different swimming strokes strengthen diaphragmatic and accessory respiratory muscles, enhance vital capacity, and optimize gas exchange. Effective ventilation influences arterial carbon dioxide, PaCO2 levels. As CO2 is a crucial regulator of cerebral artery tone, synchronized respiration guarantees consistent cerebral perfusion. Aquatic exercise facilitates parasympathetic activation, resulting in reduced blood pressure and fewer systemic stress responses. Impacts on metabolic processes and lipid profiles. Clinical study confirms swimming's positive effects on lipid profiles and glycemic control in older individuals. Studies indicate reduced LDL cholesterol, elevated HDL cholesterol, improved fasting glucose and insulin levels, and minor reductions in systolic blood pressure among participants in structured swimming programs compared to sedentary controls. For those unable or unwilling to participate in lap swimming, water walking, aquatic aerobics, and stationary pool activities provide various equivalent benefits. These approaches provide gradual intensity modifications and include functional movements, marching, lateral stepping, and gentle kicking that improve cardiovascular capacity while minimizing joint strain. Security and practical implementation. Initiate an aquatic regimen consisting of sessions lasting 20 to 30 minutes, 2 to 3 times per week, and progressively increase duration or intensity as feasible. Supervised facilities and life-guarded pools are beneficial, particularly for those with cardiovascular conditions, epilepsy, or balance impairments. Flotation devices improve safety and aid in gradual acclimation for non-swimmers. Individuals with implanted devices, uncontrolled arrhythmias, or severe pulmonary conditions should consult healthcare professionals before initiating water exercise, since immersion and exertion might cause hemodynamic changes. Aquatic exercise programs are available in community centers, YMCAs, and senior facilities for those with limited pool access. Activities may be adapted for seated or shallow water formats based on varying depth and buoyancy requirements. Resistance training. Resistance training has emerged as a crucial component of comprehensive strategies to maintain vascular and metabolic health in older adults. Aerobic exercise is essential for cardiovascular fitness, whereas resistance training especially promotes skeletal muscle development and function elements intimately linked to insulin sensitivity, body composition, metabolic rate, and systemic inflammation. Contrary to the misconception that strength training requires heavy weights and high-intensity, evidence indicates that even light to moderate resistance applied consistently with progressive overload yields clinically significant reductions in stroke and cardiovascular risk. Muscle operates as metabolic tissue. Skeletal muscle is the largest insulin-responsive tissue in the body and serves as a main reservoir for the clearance of postprandial glucose. The age-related reduction in muscle mass, termed sarcopenia, impairs the body's capacity to clear glucose after meals, resulting in insulin resistance and disrupted metabolic control. Resistance training enhances muscle protein synthesis, preserves or increases lean mass, and elevates mitochondrial function and capillary density in muscle tissue. As lean mass grows or is maintained, the body more effectively utilizes circulating glucose, reducing the requirement for pancreatic insulin synthesis and mitigating hyperglycemia and hyperinsulinemia that lead to endothelial damage. Obesity, inflammation, and myokines. Resistance training mostly decreases visceral adiposity, the metabolically active fat that accumulates in the abdominal area, and secretes pro-inflammatory cytokines such as interleukin-6 and tumor necrosis factor alpha. Visceral fat causes chronic low-grade systemic inflammation, which facilitates atherogenesis and destabilizes atherosclerotic plaques. Conversely, contracting skeletal muscle releases myokines, such as irisin and IL-6, which exhibit anti-inflammatory properties when rapidly secreted from muscle alongside other compounds that provide beneficial metabolic and anti-inflammatory benefits. Increases in adiponectin associated with improved metabolic health are linked to enhanced endothelial function and anti-atherogenic signaling, information obtained from clinical trials and cohort studies. Comprehensive epidemiological and interventional studies validate these mechanistic results. A 2019 study published in the Journal of the American Heart Association revealed that those engaging in resistance training at least bi-weekly had significantly lower risks of stroke and coronary heart disease regardless of their aerobic exercise frequency. The protective connection was seen during strength training with small weights resistance bands or body weight movements, demonstrating that functional and pragmatic resistance regimens might provide substantial benefits without the need for heavy lifting. Software development and real-world applications. Effective resistance programs for older adults often include multi-joint functional movements that align with daily activities. Examples include chair squats or sit-to-stand repetitions, lower extremity extensors, step-ups, functional balance, and leg strength, wall or inclined push-ups, upper body pressing strength, seated rows or band pulls, postural back muscle engagement, glute bridges and hip hinges posterior chain, heel raises calf strength and core stabilization exercises, such as modified planks or seated trunk rotations. A recommended routine comprises 2 full-body workouts per week, including 6 to 10 exercises targeting major muscle groups performed in 1 to 3 sets of 8 to 15 repetitions according to individual skills and goals. Emphasis should focus on controlled movement, adequate range of motion, conscious breathing, and progressive overload achieved by incremental increases in resistance repetitions or time under tension rather than through sudden maximal loads. Consistent assessment and gradual improvement facilitate adjustments while minimizing the risk of harm. Safety considerations. Medical clearance is recommended for those with unstable cardiovascular disease, uncontrolled hypertension, recent cardiac events, or other significant comorbidities. The first part of supervised training reduces injury risk, ensures proper technique, and aids in modifying resistance levels. Maintaining proper joint alignment, implementing appropriate warm-up and cool-down routines, and refraining from breath-holding Valsalva maneuver during exercise in those with cardiovascular risk further mitigate hazards. Individuals on anticoagulants should adjust high-impact exercises or activities with considerable trauma risk. Nonetheless, resistance training within safe ranges of motion and controlled loads is feasible when appropriately tailored. Choreography. Dancing serves a unique function at the intersection of physical exertion, cognitive engagement, and social connection. It incorporates aerobic activity balancing and coordination exercises, and rhythm and timing, along with the learning and retention of movement sequences, providing a full multimodal stimulus for holistic brain activation. Unlike repetitive linear exercise, dancing requires simultaneous activation of auditory, motor, vestibular, and cognitive systems, hence promoting potential neuroplastic alterations and increasing cognitive reserve. Neurobiological mechanisms. Dancing stimulates the production of neurotrophic factors, such as BDNF, which supports neuronal survival, synaptic plasticity, and neurogenesis, especially inside the hippocampus. Elevated BDNF levels are associated with improved learning and memory, along with increased resilience to neurodegenerative conditions. Dance practice, especially when it involves learning new choreography or responding to partner cues, engages procedural learning systems and enhances connectivity among cortical and subcortical motor regions, the cerebellum and prefrontal cortical networks linked to planning and error correction. Improvements in sensory integration and reaction time arise from continuous adjustments to changes in center of mass directional movements and temporal synchronization with music or partners. Psychosocial and emotional effects. Dance classes and social dancing provide opportunities for community involvement, emotional expression, and mood enhancement. Participating in movement to music promotes the secretion of neurotransmitters and hormones, endorphins, dopamine, and serotonin that elevate mood and alleviate perceived stress while lowering cortisol levels. A reduction in chronic stress is associated with lower blood pressure and a less inflammatory systemic milieu, both of which protect against the progression of atherosclerosis and stroke. Social engagement defined by regular interaction, common goals, and a sense of belonging has been linked to decreased cardiovascular morbidity and mortality in longitudinal studies. Information about epidemiology and interventions. Preliminary investigations have shown significant links between dance and cardiovascular outcomes. A comprehensive cohort study published in the American Journal of Preventive Medicine revealed that older adults who participated in regular dancing experienced a 46% lower risk of mortality from cardiovascular causes compared to those who rarely or never danced. Despite methodological differences between observational and intervention studies, the strength of the association suggests that the multifaceted engagement inherent in dance offers substantial protective benefits. The specific kind of dance is less important than consistent engagement. Ballroom, folkline dancing, Zumba Gold, and structured social dance all provide opportunities for integrated aerobic balance and cognitive improvement. Pragmatic structures and alterations. Efficient strategies for incorporating dance include enrolling in group classes tailored for seniors using guided dance films that emphasize safety and modifications, or allocating time at home to participate in movement to favored music for 20 to 40 minutes several times a week. Seated dance programs or chair-based rhythmic movement provide cognitive engagement and upper body conditioning for those with limited mobility while mitigating the risk of falls. Dance programs systematically include levels beginning with fundamental step patterns and graduating to complex choreography as confidence and stamina increase. Emphasizing appropriate footwear joint comfort and surface traction reduces the chance of injury. Those with cardiovascular disease or on anticoagulants may find low-impact partner or group dances advantageous compared to high-risk styles linked to falls or collisions. Integration and synergy among modalities. Across the 5 modalities, prominent themes include the need for integrating moderate regular movement into daily routines, the emphasis on various interrelated physiological systems, and the possibility of attaining both physical and psychological benefits. The amalgamation of modalities often yields synergistic advantages. For example, integrating resistance training with brisk walking concurrently improves muscular metabolic capacity and aerobic conditioning. Including Tai Chi or Dance Weekly supports neuroplasticity and balance. Aquatic sessions provide joint-friendly options when musculoskeletal pain limits land-based activities. Diversity promotes enduring commitment by reducing monotony and providing many rewards: physical skill, social interaction, intellectual engagement, and emotional enhancement. Chronobiology and exercise timing. The timing of exercise concerning circadian rhythms is an increasingly recognized element in exercise prescription. Physiological factors relevant to stroke risk, blood pressure, cortisol production, glucose metabolism, endothelial function, and autonomic balance exhibit diurnal variation. Standard circadian rhythms include a little elevation in blood pressure and cortisol levels in the early morning, the morning surge followed by daytime stability, and a nocturnal reduction in blood pressure throughout sleep for many individuals. Recent study indicates that the timing of exercise may influence these cycles, hence affecting cardiovascular and metabolic outcomes. Advantages of morning exercise. Multiple studies, including those included in cardiovascular prevention journals, indicate that exercising in the morning, specifically about 700 a.m., is advantageous. Engaging in physical activity at around 10:00 a.m. may provide greater long-term blood pressure management and improved endothelial function compared to exercise performed later in the day for some individuals. Morning exercise may mitigate the magnitude of the morning blood pressure surge, affect cortisol levels, and prime metabolic pathways for daily food intake. A brief morning session lasting 10 to 15 minutes of light activities, such as stretching Tai Chi or gentle walking or a 30-minute brisk walk, can initiate beneficial physiological processes, improving glucose metabolism after breakfast, and fostering a favorable autonomic state that may persist throughout the day. Evening exercise and customization. This does not imply that those who exercise in the evening get no benefits. Most research indicates that the total volume of activity and consistency are the primary determinants of health gains. For many individuals, engaging in physical activity throughout the evening improves sleep quality and reduces stress. Certain individuals may find that participating in intense exercise close to bedtime impedes sleep initiation by increasing arousal or delaying melatonin release. For these individuals, arranging workouts earlier in the evening or selecting moderate to low-intensity activities such as stretching Tai Chi or light resistance training may prove more advantageous. Chronotype, designating whether an individual is a morning or evening person, profoundly affects exercise adherence and physiological suitability, with those exhibiting late chronotypes perhaps gaining advantages from exercises scheduled later in the day. Effectively optimizing timing requires integrating potential circadian benefits with personal schedules, sleep patterns, and the likelihood of adherence. Mechanistic intricacies. The mechanistic foundation for timing effects is complex. Morning exercise may affect sympathetic activity at a crucial portion of the circadian cycle, mitigate endothelial dysfunction associated with postprandial metabolic stress, and improve insulin sensitivity for subsequent meals. Conversely, evening exercise may be particularly advantageous for improving glucose control after late meals and for those whose daily schedules restrict early activity. Ultimately, while time may provide some benefits, consistency, total weekly volume, and appropriate intensity are the essential determinants for stroke prevention. Safety assessment and health considerations. Safety and individualized adaptation are essential across modalities. Individuals aged over 50, particularly those with pre-existing cardiovascular disease, uncontrolled hypertension, recent orthopedic injuries, or other chronic conditions, should see a healthcare professional before starting a new or substantially intensified exercise program. Systematic pre-participation screening facilitates the identification of contraindications and assesses the need for testing, including exercise stress testing in specific cardiac populations. Notable pragmatic considerations include gradual progression. Initiate with short durations and low intensities, systematically increasing volume and intensity, for example, 10% weekly increments in duration or volume where feasible. Warm up and cool down. Utilize active warm-up methods to ready the joints and cardiovascular system. Finish with gentle stretching and breathing exercises to normalize heart rate and blood pressure. Water and thermoregulation. Elderly adults often have reduced thirst perception. Emphasizing hydration and avoiding elevated temperatures alleviates cardiovascular strain. Medication interactions. Antihypertensives, especially beta blockers, alter heart rate responsiveness. Perceived exertion may function as a more reliable intensity gauge than heart rate targets in these individuals. Anticoagulants need caution during activities with a high risk of falls. Modify movements to diminish the probability of severe injuries and confer with prescribers about contact activities. Balance and fall risk. Individuals with significant balance impairments may benefit from supervised programs, aquatic training, seated modalities, or the use of assistive devices, walkers' handrails to reduce risk while preserving advantages. Symptom monitoring indicators, including chest pain, unexplained syncope, sudden severe dyspnea, new palpitations or neurological symptoms, sudden weakness, slurred speech, or visual problems, need immediate medical evaluation. Supervision and direction. Initial sessions with certified professionals, physical therapists, licensed exercise physiologists, Tai Chi teachers, specializing in health populations, and aquatic therapists, improve technique, confidence, and safety. Particular apprehensions about atrial fibrillation and anticoagulant therapy. Atrial fibrillation, AF, markedly elevates the risk of cardioembolic stroke, prompting several persons with AF to get therapy with oral anticoagulants. Exercise is essential for this population. However, programs should exclude activities that provide a considerable risk of head injury or falls. Aerobic resistance and supervised balance programs are often recommended. However, contact sports with considerable collision risk should be avoided. The overall benefit of physical exercise for persons with atrial fibrillation is favorable when appropriately tailored and included in cardiology therapy. A prototype weekly framework. A synthesized weekly framework that integrates the 5 senses while emphasizing practicality, equilibrium, and safety may improve real-world application. This example regimen is suitable for a generally healthy older adult with modifications provided for common limitations. Essential method for a generally healthy elderly individual: Monday morning brisk walk, 25-30 minutes, moderate intensity. A 10-minute leisurely walk after dinner. Tuesday, engage in resistance training for 20-30 minutes, including a full-body program consisting of 6 to 8 functional movements, doing 1-2 sets of 8-12 repetitions. Wednesday, engage in a Tai Chi class or conduct a home practice for 30 minutes, focusing on balanced breathing and gentle movement. Thursday, engage in a strenuous walk for 25 to 30 minutes in the morning. Optional social participation throughout the nighttime hours. Friday, resistance training, 20-30 minutes, progressive, emphasizing different movement patterns from Tuesday. Saturday, participate in a dance class or engage in social dancing for 30-45 minutes, moderate intensity. Prioritize enjoyment and cognitive engagement. Sunday, participate in swimming or aquatic exercise for 20 to 30 minutes, or alternatively engage in a restorative walk or yoga session. Participate in 10-15-minute walks after 2 significant meals each week. This routine includes 150-210 minutes of moderate aerobic exercise weekly, complemented by 2 strength training sessions, and the inclusion of balance and neuroplasticity activities like Tai Chi and dance. Swimming may serve as an alternative to walking for those with joint limitations. For those with significant deconditioning, begin 10-15-minute aerobic sessions and single-set resistance training bi-weekly, progressively increasing intensity over 6 to 12 weeks. For those with limited mobility or increased fall risk, replace standing activities with seated dance, chair-based strength training, aquatic exercises, and supervised Tai Chi or balance training. Tailoring to comorbid illnesses and personal preferences. Individual preferences and comorbidities are critical to adherence. Individuals with osteoarthritis may prefer aquatic sessions and prolonged warm-ups. Those with chronic obstructive pulmonary disease may benefit from interval walking that includes pacing and breath control strategies. Individuals with depression may achieve heightened engagement through social interaction in dance or group Tai Chi. The most effective software is one that an individual finds pleasurable, can access reliably, and can navigate safely. Conclusive synthesis. Stroke is not an inevitable consequence of aging. The amalgamation of epidemiological data and clinical trials reveals intentional, consistent physical activity as a crucial factor in stroke prevention. Each modality examined herein pertains to overlapping but distinct physiological systems that, when combined, tackle multiple facets of vascular risk. Tai Chi rehabilitates proprioceptive networks, enhances balance, and regulates autonomic function to reduce blood pressure and decrease fall risk while fostering neuroplasticity and cognitive resilience. Brisk walking enhances cerebral blood circulation, stimulates the development of new blood vessels, and improves metabolic regulation, especially when performed consistently and strategically after meals to reduce postprandial glucose surges. Swimming and aquatic exercise provide a low-impact but comprehensive challenge to the cardiopulmonary and muscular systems, improving stroke volume, respiratory function, and endothelial performance, while minimizing orthopedic constraints. Resistance exercise preserves and augments metabolically active muscle mass, hence enhancing insulin sensitivity, diminishing visceral fat, and mitigating systemic inflammation, elements directly linked to the progression of atherosclerotic disease. Dancing integrates cardiovascular exercise, balance, coordination, cognitive engagement, and social contact, hence strengthening neurotrophic pathways and improving mood and autonomic balance. The timing of exercise, particularly including morning sessions when feasible, may augment benefits by aligning activity with circadian physiology to maximize blood pressure management and metabolic responses. The main elements affecting benefits are the total quantity of exercise, consistency, and safety. Prevention is a proactive initiative that combines medical therapies such as blood pressure management, anticoagulation, where required, cholesterol regulation, and glycemic control, with lifestyle modifications, including physical activity, diet, sleep, and social interaction. Integrating one or more of these evidence-based activities into a tailored weekly program aligned with individual health status and preferences while observing appropriate safety precautions may substantially impact the advancement of vascular aging. The choices made today, deliberate methodical actions done with regard to timing, variety, and enjoyment, can markedly improve future health outcomes, reducing the risk of stroke and preserving functional independence and quality of life. Thank you for watching the video. Please let us know your thoughts, and goodbye for now.